Hey there dog lovers. Welcome back to Animal Dynasty. Today, I'll walk you through some of the deadliest viruses that might affect your dogs. Let's get started. Canine Parvovirus. Canine Parvovirus, CPV, is believed to have originated in the late 1970s as a mutation of feline panleukopenia virus, FPV, or a similar virus found in wild carnivores. Scientists suspect that genetic changes in FPV allowed it to jump species and infect dogs. Origins and evolution. First outbreak 1978 to 1980. A new and deadly virus spread rapidly among dogs worldwide, causing high mortality rates. Mutation from feline panleukopenia. Genetic studies suggest that CPV evolved from FPV, as both viruses share about 98% of their DNA. Wildlife reservoirs. Parvovirus-like strains have been found in foxes, raccoons, and other wild carnivores, indicating the virus may have passed between species before adapting to dogs. New strains over time. CPV has continued to evolve, with new strains, CPV2A, CPV2B, CPV2C, emerging, making it more contagious and severe. Parvovirus is now found worldwide but can be prevented with timely vaccination and good hygiene practices. Canine Parvovirus, Parvo, primarily attacks the gastrointestinal, GI, tract, causing severe symptoms like severe vomiting, bloody diarrhea, often with a strong odor, lethargy and weakness, loss of appetite, fever or low body temperature, rapid weight loss and dehydration. How Parvo spreads. Parvovirus spreads through direct contact with infected dogs or contaminated objects like food bowls, floors, soil, or even human hands and clothing. It is extremely resistant to disinfectants and can survive in the environment for months. Why is Parvo dangerous? It kills intestinal cells, leading to life-threatening dehydration and secondary infections. Puppies are most vulnerable because their immune systems are weak. Without treatment, Parvo has a very high mortality rate. How to prevent Parvo? Vaccinate your puppy on schedule, starting at 6 to 8 weeks old. Avoid taking your puppy to public places, dog parks, sidewalks, pet stores, until fully vaccinated. Regularly clean and disinfect areas where dogs eat, sleep, and play. Keep your dog away from infected dogs or unknown environments. Treatment for Parvo. There is no direct cure for Parvo, but intensive supportive care can help puppies recover. Treatment usually includes IV fluids to prevent dehydration, medications to control vomiting and diarrhea, antibiotics to prevent secondary infections, hospitalization in severe cases. Even with treatment, Parvo can be fatal, so early detection and immediate veterinary care are crucial. Rabies. Origin of rabies. Rabies is one of the oldest known diseases, with records dating back at least 4,000 years. The exact origin is unknown, but historical evidence suggests it has been around since ancient times, evolving alongside mammals. Early history and first records. Mesopotamia around 2300 BCE. The first known reference to rabies appeared in Babylonian laws, which imposed fines if a rabid dog bit someone. Ancient Greece 400 BCE. The famous physician Hippocrates described symptoms resembling rabies. Roman Empire 100 CE. Roman scholar Celsus documented that rabies was transmitted through dog bites. Possible evolution and spread. Scientists believe rabies originated in wild carnivores and gradually spread to domestic dogs and humans through bites. The virus likely evolved from ancient viruses in bats or other wild animals, later adapting to new hosts. How rabies became a global disease. Wild animal reservoirs. Rabies spread among wolves, foxes, and bats, becoming a permanent threat. Domestication of dogs 10,000 plus years ago. As humans domesticated dogs, the virus began affecting both animals and people. Global trade and exploration. Rabies spread worldwide through trade routes, colonization, and human migration. Scientific discoveries and modern prevention. 1885, Louis Pasteur developed the first rabies vaccine, saving a young boy who had been bitten by a rabid dog. 20th century, widespread vaccination of dogs drastically reduced rabies cases in many countries. Today, rabies still exists in Asia, Africa, and parts of Latin America, mainly due to unvaccinated stray dogs and wildlife transmission. Rabies is a deadly viral disease that affects the central nervous system, CNS, of mammals, including humans and dogs. It is caused by the rabies virus, RABV, which belongs to the Lissa virus genus. The disease is almost always fatal once symptoms appear. How rabies spreads. Bites from an infected animal, most common transmission method. Saliva entering open wounds, cuts, or mucous membranes, eyes, nose, mouth. Rare cases of transmission through organ transplants. In most cases, dogs, bats, foxes, raccoons, and skunks are common carriers. Stages and symptoms of rabies. 1. Incubation period, 2 to 12 weeks, but can be longer. No symptoms appear during this time. The virus slowly travels through the nerves toward the brain. 2. Prodromal stage, first signs appear, 2 to 3 days. Fever. Change in behavior, aggression, anxiety, or hiding. Excessive licking or biting at the bite site. 3. Furious rabies, aggressive form, 2 to 7 days. Extreme aggression and restlessness. Excessive drooling, foaming at the mouth. Hypersensitivity to light and sound. Seizures. 4. Paralytic rabies, dumb rabies, 2 to 4 days. Weakness and paralysis, starting in the legs. Dropped jaw and difficulty swallowing. Coma, leading to death. Why rabies is dangerous. Once symptoms appear, rabies is 100% fatal. The virus directly attacks the brain and spinal cord, leading to paralysis and death. There is no cure, but post-exposure treatment, rabies shots, can prevent the disease if given early. Prevention of rabies. Vaccinate your pets. Puppies should get their first rabies shot at 12 to 16 weeks old, then boosters is required. Avoid contact with wild or stray animals. Seek immediate medical attention if bitten by a suspicious animal. Report stray or aggressive animals to local authorities. Rabies remains a serious global health issue, but vaccination and awareness can prevent its spread. Canine distemper. Origin of canine distemper. Canine distemper is believed to have originated thousands of years ago, likely evolving from a common ancestor of the measles virus in humans and the rinderpest virus in cattle. Scientists suggest that the virus first appeared in wild carnivores before spreading to domestic dogs. Historical background. First recorded outbreak 1700s to 1800s. The earliest descriptions of a distemper-like disease in dogs date back to 18th century Spain. Spread to Europe mid-1700s. The disease spread across Europe and Asia, devastating dog populations. Global expansion 19th to 20th century. As dogs traveled with humans through colonization and trade, the virus spread worldwide. How did distemper evolve? Mutation from rinderpest. Canine distemper is closely related to rinderpest, a cattle disease that was eradicated in 2011. Some scientists believe CDV evolved when dogs came into contact with infected livestock, allowing the virus to jump species. Wildlife reservoirs. The virus likely circulated in wolves, foxes, raccoons, and other wild carnivores before infecting domestic dogs. Even today, wild animals still carry and spread distemper. Modern impact. Still widespread in unvaccinated dog populations, especially in developing countries. Affects wild animals, including lions, tigers, and ferrets. Vaccination has significantly reduced cases in pets, but outbreaks still occur in areas with low vaccination rates. Canine distemper, a deadly viral disease. Canine distemper is a highly contagious and often fatal viral disease that affects dogs and other animals like ferrets, foxes, and raccoons. It is caused by the canine distemper virus, CDV, which belongs to the morbillivirus family, the same family as the measles virus in humans. How distemper spreads. The virus spreads through direct contact with infected dog's saliva, urine, or blood. Airborne exposure. Coughing, sneezing. Contaminated objects. Food bowls, bedding, water. Wildlife reservoirs. Foxes, raccoons, and skunks can carry the virus. Symptoms of canine distemper. 1. Early stage 1 to 2 weeks after infection. Fever. Nasal discharge, runny nose. Eye discharge, watery or pus-like. Coughing. Loss of appetite and lethargy. 2. Gastrointestinal and respiratory stage. Vomiting and diarrhea. Pneumonia, difficulty breathing. Thickening of paw pads and nose, hard pad disease. 3. Neurological stage severe cases. Tremors or muscle twitching. Seizures often called chewing gum fits, due to jaw movements. Paralysis, confusion and behavioral changes. Why distemper is dangerous. No cure. Treatment only supports the immune system while the virus runs its course. Highly fatal, especially in puppies and unvaccinated dogs. Can cause permanent neurological damage in survivors. Prevention, the best protection. Vaccinate puppies, starting at 6 to 8 weeks old, with boosters at 12 and 16 weeks. Avoid contact with unvaccinated dogs and wildlife. Disinfect surfaces where infected dogs have been. Can dogs survive distemper? Some dogs recover, but they may suffer lifelong issues like tremors or seizures. Many infected dogs do not survive, especially without early treatment. And that's everything you need to know about the most deadly dog viruses. If you found this video helpful, give it a thumbs up, subscribe for more pet care tips, and drop a comment if you have any questions. See you in the next video.